This is All India Radio. We now bring you a special news program on COVID-19. Good morning. I'm Abhishek Mukhopadhyay and with me is Vaibhav J. Srivastav. The headlines. Prime Minister Narendra Modi to share his thoughts in Mann Ki Baat program of All India Radio at 11 a.m. today. People urged to donate generously in PM Cares Fund. Prime Minister says every contribution matters in fight against COVID-19. Government exempts farming and allied activities from lockdown. Home Ministry asks states to set up relief camps for migrant workers. And Finance Minister Nirmala Sitharaman asks public and private sector banks to ensure adequate liquidity at branch, ATM and banking correspondent level. Prime Minister Narendra Modi will share his thoughts with the people in the country and abroad in his Mann Ki Baat program on All India Radio at 11 a.m. today. It will be the 63rd episode of the monthly radio program. In a tweet, Prime Minister said the episode will focus on the situation prevailing due to COVID-19. It will be broadcast on the entire network of AIR and Doordarshan and also on AIR News website www.newsonair.com and News on AIR mobile app. It will also be streamed live on the YouTube channels of AIR, DD News, PMO and Information and Broadcasting Ministry. AIR will broadcast the program in regional languages immediately after the Hindi broadcast. The regional language versions will also be repeated at 8 in the evening. Prime Minister Narendra Modi has announced the constitution of the PM's Citizen Assistance and Relief in Emergency Situations, PM Cares Fund. This will be a dedicated national fund with the primary objective of dealing with any kind of emergency or distress situation like posed by the COVID-19 pandemic. Prime Minister is the chairman of this trust and its members include Defence Minister, Home Minister and Finance Minister. Citizens and organizations can go to the website pmindia.gov.in and donate to PM Cares Fund. This fund will enable micro donations, allowing a large number of people who will be able to contribute with the smallest of denominations. Donations to this fund will be exempted from income tax under Section 80G. In a series of tweets, Prime Minister said people from all walks of life has expressed the desire to donate to India's war against COVID-19. He appealed to the people to contribute to the PM Cares Fund. Prime Minister said this will go a long way in creating a healthier India. He said this fund will also cater to similar distressing situations if they occur in times ahead. Prime Minister said that every single contribution in the PM Cares Fund matters and there is nothing big or little. Reacting to the enthusiastic response of the people, he said that it shows a collective resolve to defeat COVID-19. In response to a student's contribution, Prime Minister said the future of the nation is ensuring the nation's future. The account number for the PM Cares Fund is 2121 PM 20202 with IFSC code SBI N 0000691. The SWIFT code is SBI NINBB 104 and the UPI ID is PM Cares at SBI. People can also donate to the fund on pmindia.gov.in using UPI, net banking, RTGS, NEFT and debit and credit cards.
Supreme Court Judge Justice N.V. Ramanna has contributed 1 lakh rupees to the Prime Minister's Relief Fund. He also donated 1 lakh rupees each to relief funds of Telangana and Andhra Pradesh. Justice Ramanna has also requested the public to abide by the instructions of the government and take proper measures. He also requested people to follow social distancing method to effectively fight against COVID-19 unitedly. The Board of Control for Cricket in India, BCCI, will contribute 51 crore rupees to PM Cares Fund. In a release, BCCI President Saurav Ganguly said this will strengthen the nation's disaster management capacities and encourage research to combat COVID-19. He said COVID-19 is first and foremost public health emergency and the BCCI has a firm resolve that the nation gets all possible help to cope with the testing times. BCCI's affiliated units have also contributed in this donation.
Lok Sabha Speaker Om Birla has urged all the members of Parliament to send consent forms for allocation of minimum 1 crore rupees from the MP Lads Fund to fight COVID-19 pandemic. Mr. Birla has asked them to forward the consent letters to Ministry of Statistics and Program Implementation for allocation of the amount for the availability of screening kits, masks, personal protection kits and other medical equipments needed to fight the COVID-19 pandemic. He emphasized that the people's representatives should ensure that the lockdown does not impede the poor and the needy in meeting their basic needs. All BJP MPs will release 1 crore rupees each from the MP Lads Fund to the Central Relief Fund to support the fight against COVID-19. BJP National President JP Nadda announced the decision in a tweet. He said party MPs and MLAs will also donate their 1 month's salary to the Central Relief Fund to support the fight.
Bollywood superstar Akshay Kumar has pledged to donate 25 crore rupees to PM Cares Fund. In a tweet, the actor said he will contribute the donation amount to PM Narendra Modi's relief fund from his savings. He said this is the time when all that matters is the lives of our people. Digital payments company Paytm has said it aims to contribute 500 crore rupees to PM Cares Fund. Paytm President Madhur Deora said for every contribution or any other payment made on Paytm using the wallet, UPI and Paytm bank debit card, the company will contribute an extra up to 10 rupees. Mr. Deora said money would be directly sent to the PM Cares Fund. He said they are honoured to do their duty to aid the government in all the relief measures being taken to fight the corona pandemic.
Union Home Ministry has asked the states to help migrant workers by setting up shelters and provide food to them. Addressing a press conference in New Delhi yesterday, Joint Secretary in the Home Ministry, Punya Salila Srivastav, urged each and every citizen to stay wherever they are. She said the migration defeats the purpose of lockdown as it can potentially spread the deadly novel coronavirus from one place to another. She said Home Ministry is regularly monitoring the movements of essential goods and enforcement of lockdown with the states.
States can explore the option of setting up tented accommodation for those who are on the road और जिनको अभी वापस लाने में समय लगेगा. दूसरा, जहां भी रिलीफ कैंप्स है वहां पे मेडिकल चेकअप ड्राइव्स करवाएं जिससे कि हमें पता चल सके कि हाउ इज द हेल्थ स्टेटस और उस पर फिर अकॉर्डिंगली स्टेट्स और यूटीज एक्शन ले सकती हैं.
Briefing Media Joint Secretary in the Health Ministry, Love Agarwal, said that the centre is engaged with the state governments to implement rigorous contact tracing, community surveillance and the containment strategy. He said the centre and the states are making efforts to ensure that lockdown and social distancing are followed properly. He added that the centre is working with the states on health infrastructure preparedness. He also said the major focus is to set up dedicated COVID-19 hospitals and blocks.
हमारा कंबाइंड एफर्ट यही इंश्योर करना है कि लॉकडाउन और सोशल डिस्टेंसिंग का प्रॉपर तरीके से पालन किया जाए. कोविड-19 से लड़ने के लिए गवर्नमेंट ऑफ इंडिया अभी हेल्थ इंफ्रास्ट्रक्चर प्रिपेयर्डनेस पर स्टेट के साथ काम कर रही है. हमारा मेजर फोकस है कि हम डेडिकेटेड कोविड हॉस्पिटल्स बनाएं, डेडिकेटेड कोविड ब्लॉक्स बनाएं और साथ ही आइसोलेशन बेड्स, आईसीयू बेड्स और जो रिक्वायर्ड लॉजिस्टिक्स है उसके लिए तैयार करें. मिनिस्ट्री ने कोविड के रेस्पॉन्स को स्ट्रेंथन करने के लिए स्टेट के लिए स्पेसिफिक नोडल ऑफिसर्स भी नियुक्त किए हैं.
Mr. Agarwal said the government has decided to allow CGHS patients who are chronic to avail medicines for 3 months.
लॉकडाउन में पेशेंट्स को किसी भी तरह की दिक्कत ना हो, इसके तहत ही हेल्थ मिनिस्ट्री ने एक आदेश जारी किया है कि सीजीएचएस में जो हमारे क्रोनिक पेशेंट्स हैं उनको 3 महीने की दवा एक साथ इशू की जाए और पेशेंट को खुद ना जाना पड़े. खासकर वो पेशेंट जो कि इम्यूनोसप्रेसेंट हैं, जिनके ऑर्गन ट्रांसप्लांट, केमोथेरेपी या अनकंट्रोल्ड डायबिटीज, इस टाइप की जो बीमारियां हैं वो अपने किसी रिप्रेजेंटेटिव को भेजकर भी दवाइयां ले सकते हैं.
The total number of confirmed cases of novel coronavirus has risen to 918 in the country so far. Out of the total cases, 79 patients have been cured and discharged and 19 died. Agriculture, farming and allied activities have been exempted from the lockdown. The decision has been taken with a view to address problems being faced by the farming community. This will also ensure uninterrupted harvesting of crops. Agriculture Minister Narendra Singh Tomar has been constantly monitoring issues related to the farmers ever since the lockdown was enforced. He was apprised of the difficulties the farmers could face in the harvesting of the crops and transporting food grains to the mandis. The decision will also allow unhindered harvesting of crops. Under the second addendum issued by the Union Home Ministry, the categories that have been exempted from the lockdown include agencies engaged in procurement of agriculture products such as MSP operations, mandis operated by the Agriculture Produce Market Committee or as notified by the state government, farming operations by farmers and farm workers in the field and custom hiring centres related to farm machinery, manufacturing and packaging units of fertilizers, pesticides and seed, and intra and interstate movement of harvesting and sowing related machines are exempted from the lockdown. Other agriculture and horticulture implements have also been exempted from the lockdown.
Finance Minister Nirmala Sitharaman has asked the Chairman and Managing Director CMDs of banks to ensure adequate liquidity at the branch, ATM and banking correspondent level. Ms. Sitharaman held a detailed conversation with chiefs of public and private sector banks yesterday. In a series of tweets, she said that it is encouraging to know that they are doing their best even during the lockdown. She said they are certain that they will ensure customer service without disruption and social distancing is being adhered to as well. The Finance Minister also acknowledged the role of public sector banks and encouraged them to keep up their efforts in providing uninterrupted banking services across the country. Ms. Sitharaman also made one-to-one calls with CMDs of all public sector banks and requested them to ensure uninterrupted banking services. The Finance Minister also called the representatives of private sector banks to ensure that uninterrupted banking services are provided across the country while maintaining social distancing norms. In the wake of growing novel coronavirus cases in the country, the Health and Family Welfare Ministry has issued several advisories for the people to contain the spread of COVID-19. These advisories stress on several preventive measures like social distancing, personal hygiene and restriction of mass gatherings. Here is a report.
Government has advised people to follow basic protective measures to keep themselves safe from the coronavirus. People should strictly follow the social distancing norms and avoid gathering. They should stay at their homes and go out for buying essential items only when it is absolutely required. People are advised not to touch their eyes, nose and mouth. Frequent hand sanitization is a must. They should keep cleaning their hands with soap and alcohol-based hand sanitizers. Both sides of hand has to be washed for at least 20 seconds. If a person is experiencing cough and fever or any other symptom, he or she should avoid close contact with others and doctor should be consulted immediately. The Health Ministry has issued a toll-free number 1075 for the public inquiry about coronavirus. Bhupendra Singh, AIR News, Delhi.
This is All India Radio giving you a special news program on COVID-19. Let's take a look at the headlines once again. Prime Minister Narendra Modi to share his thoughts in Mann Ki Baat program of All India Radio at 11 a.m. today. People urged to donate generously in PM Cares Fund. Prime Minister says every contribution matters in fight against COVID-19. Government exempts farming and allied activities from lockdown. Home Ministry asks states to set up relief camps for migrant workers. And Finance Minister Nirmala Sitharaman asks public and private sector banks to ensure adequate liquidity at branch, ATM and banking correspondent level. For quick news updates around the clock, follow us on our Twitter handle at EIR News Alerts. Delhi government has started 800 centres to provide cooked meals to 4 lakh poor people of the city from today in view of the lockdown. Addressing media, Delhi Chief Minister Arvind Kejriwal said food has been distributed free of cost to these people through 568 schools and 238 night shelters. He said flying squads are patrolling in each district of the city and distributing food packets to the needy. A report.
Delhi government has appealed to the migrant workers not to leave Delhi due to lockdown as it is making arrangements of food and shelter for them. Food and water facility have also been set up at Delhi border areas to accommodate the migrant workers who are living. As many as 1,000 fair price shops in the city have also started distributing 7.5 kg free ration per person. Wheat and rice are being provided under it and 71 lakh people will be benefited from the initiative. Anand Kumar, AIR News, Delhi.
In order to provide personal protection gears to the health workers and other related officials, the Himachal Pradesh government has created the HP COVID-19 Solidarity Response Fund. The state government has also set up government organization and non-government organization coordination platform GO NGO for disaster response and disaster preparedness. Our correspondent reports that the telemedicine hub is also being created in the state to provide consultancy remotely. A report.
HP COVID-19 Solidarity Response Fund will ensure a smooth supply of essential commodities like food items and medicines beside health equipment for health workers. Donation for this cause could also be made through online link www.himachal.nic.in. Chief Minister Jairam Thakur urged the people to come forward generously to donate. On the other hand, Himachal Pradesh State Disaster Management Authority has formed Go NGO coordination platform for better facilitation of the emergency supplies and services in the districts. Considering the current public health crisis have arisen, state government has decided to involve voluntary organization and encouraging citizens to volunteer to register online through www.hpsdma.nic.in. The state government is also creating telemedicine hub which would be connected with the health wellness center across the state. The center will give its service from 8 a.m. to 8 p.m. in the field of medicine, pediatric and psychiatry. Meanwhile, all the 29 suspected cases of COVID-19 who came in contact with 3 positive patients in the state found negative. Out of 3 positive patients, 2 have been recovered while 1 detected positive after death. Sanjeev Sundariyal, AIR News, Shimla.
In Uttar Pradesh, all efforts are being made to contain the spread of coronavirus. The government is trying to implement lockdown strictly. The government is providing food and other grocery items to people at their doorsteps. Chief Minister Yogi Adityanath has said that no one should remain hungry. He is keeping a vigil on the situation. More from our correspondent.
The Chief Minister inspected the community kitchen at Mahanagar area in Lucknow yesterday, which is set to provide food to stranded and poor people during the lockdown. A total of 12 kitchens have been established. He also inspected quarantine beds in SGPGI Lucknow, which have been prepared according to the international standards. The government intends that nobody should remain hungry and stay at their houses during the lockdown period. More than 1,37,000 food packets were distributed, and the government is ensuring supply of milk. The government is also taking strict action against those who are trying to break the lockdown rules. FIR against 4,642 people have been lodged, and more than 1,15,000 vehicles were issued notices, while 9,293 vehicles were seized. The people who have come from outside states in the last 2 weeks have been quarantined for 14 days. With MS Yadav's report, Tanvi Khurana, AIR News.
In Uttar Pradesh, authorities in Noida and Lucknow have passed an order asking landlords to collect rent from the worker tenants only after a month in wake of COVID-19. The orders were issued by district magistrates of Gautam Budh Nagar and Lucknow using the powers of rent control. The orders comes into effect immediately. District magistrates of Noida, BN Singh, said there are migrants living in Noida and Greater Noida who are involved in production and distribution of essential services, but they too are being forced to leave for their homes. Invoking the special powers vested in the district magistrate, he ordered that no landlord will demand rent till next month for accommodation from the tenants who are labourers or workers working in any of the companies, industries, factories and offices in the district. Lucknow District Magistrate Abhishek Prakash said that some landlords were seen to compel labourers, students and other workers from their houses and demanding advance rent. He said the order has been issued and landlord will not demand house rent till 1 month. He said that strict action will be taken against a landlord who transgress these instructions. Bihar government has set up shelter homes with free food and lodging facilities at border areas for migrant labourers entering the state from UP, Jharkhand and West Bengal. Chief Minister Nitish Kumar has appealed to migrants to stay wherever they are in the wake of the lockdown. He said the buses may come as a relief for these people who have been facing difficulties for the last few days, but if any person amongst these passengers are found infected, then it will create a big difficulty.
Madhya Pradesh government has asked jail superintendents to seek interim bail from courts for under-trial prisoners arrested in cases where the punishment is 5 years imprisonment or less. The step is being taken to decongest overcrowded jails in view of the pandemic. So far, 39 COVID-19 patients have been detected in Madhya Pradesh. 2 of them have died. DGP Vivek Johari has suspended 3 DSPs for not attending the duty at COVID-19 related Smart City Control Room, Bhopal. A report.
Earlier this week, the Supreme Court had directed all the state and union territories to constitute committees to consider releasing jail inmates on payroll or interim bail in case where maximum punishment is 7 years. Jail officials have been asked to complete the process within 4 days. As per the order, the interim bail plea should not be for more than 45 days. There are 125 jails in the state holding over 42,000 prisoners against the sanctioned capacity of around 28,000. Meanwhile, BJP workers will deliver food and other essential goods to the 45 lakh poor and helpless people of the state. The central leadership of the party has asked the state unit to make a list of 9 lakh workers so that these workers can provide food and other assistance to the families of the affected in order to fight the corona. Sanjeev Sharma, AIR News, Bhopal.
Amidst the coronavirus crisis, Chhattisgarh government has invoked the Essential Services Maintenance Act ESMA for all health services of the state. Now all government and private hospitals have been brought under essential services in the state. Food Corporation of India will now sell wheat in Chhattisgarh. Traders and flour mills of the state will be able to lift wheat stock at a prescribed rate. With this initiative, wheat will be easily available to the common citizens at a fixed rate during the lockdown. A report.
Raipur Railway Division has decided to convert 10 train coaches into the isolation wards to save lives of coronavirus infected patients. These coaches will be completely sanitized before installing medical equipments. Apart from this, the families of the employees of Raipur Railway Division are contributing to the prevention of coronavirus infection by making masks. About 2,000 masks have been prepared. All these masks have been given to the railway employees who are involved in the maintenance and operation of goods trains. Meanwhile, the special food cell has been set up by the Raipur District Administration to provide food to beggars, destitute people, needy and laborers during the lockdown. At the same time, for the strict implementation of lockdown, every vehicle is being monitored in Raipur city round the clock with the help of drones and street cameras. Vikalp Shukla, AIR News, Raipur.
Maharashtra Health Minister Rajesh Tope said that COVID-19 patients in the state will be treated free of cost under the state government's Mahatma Jyotiba Phule scheme. He said the novel coronavirus infection is included in the list of ailments covered under the scheme. Tope said that the total of 1,000 hospitals will be included in the scheme from April 1st, where patients can avail free treatment. He informed that impaneled hospitals will get 2,000 ventilators. As of now, 492 private hospitals in the state are part of the scheme. The minister has asked people to cooperate with the government during the 21-day lockdown imposed to fight the outbreak. Gujarat government has announced to set up 100-bedded hospital in each district to combat COVID-19. Chief Minister Vijay Rupani made 3 major announcements as part of the state's fight against COVID-19. A report.
The hospital will be equipped with ICU and ventilator facility. He also announced to give 25 lakhs rupees to the family of policeman who dies on duty during the lockdown period. Apart from this, CM said all the MLAs in the state will donate rupees 25 lakhs to Gujarat Health Society to purchase medical equipment to combat COVID-19. BJP MLAs in the state decided to donate their 1 month's salary to CM Relief Fund to fight against coronavirus pandemic. Aparna Khund, AIR News, Ahmedabad.
In Karnataka, 76 COVID-19 positive cases were confirmed till yesterday afternoon, which includes 3 deaths and 5 people being discharged. In the designated hospital, 68 positive cases who are in isolation are stable. In the wake of nationwide lockdown till April 14th, the Bengaluru Municipal Corporation is distributing around 1 lakh food packets through Indra canteens. Helpline number 155214 has been established for the migrant labourers for food assistance. Railway Protection Force staff in Bengaluru is providing food to about 250 daily wage labourers. Several labourers coming from Goa and Maharashtra are being accommodated in Belagavi. They are provided medical checkup before sending them to their villages in Raichur, Vijayapura and Bagalkote. More from our correspondent.
The Bengaluru Railway Division Hospital has earmarked 3 wards with 50 beds with isolation facilities for the corona patients. About 200 rooms in the training center and the Institute of Disaster Management are kept as standby for quarantine facilities. 17 hotels in Bengaluru will be rented out to isolate primary and secondary contacts of the COVID-19 positive persons till their samples are tested. The war room in Bengaluru has trained doctors manning urban primary health centers on how to handle patients walking in with COVID-19 symptoms. Overall, 180 187 frontline warriors were trained in the war room on standard operating procedures to deal with coronavirus suspected patients. Sudhindra, AIR News, Bengaluru.
Total number of COVID-19 cases in Kerala has gone up to 165 with confirmation of 6 more cases. First death due to COVID in Kerala occurred yesterday at Kochi. More from our correspondent.
Chief Minister Pinarayi Vijayan said that all necessary action will be taken to find out the possibility of community spread of COVID-19. A rapid test will be started soon, which will ensure more faster result. The state entrance exam is postponed. Government started Break Corona project, inviting innovative ideas to contain the infection and generate income during this difficult hour. The startup mission will coordinate the project, through which ideas can be submitted online. Meanwhile, surveillance is strengthened. Drones are used to trace individuals breaking the guideline and quarantine instructions. Large-scale production and procurement of medical equipment, masks, gloves, oxygen cylinders, isolation facility, etc. is going on. Meanwhile, State Health Minister K.K. Shailaja said that the condition of all the COVID-19 patients are stable. More than 110,000 people are under observation. Mayusha for AR News from Thiruvananthapuram.
Tamil Nadu government has been decided to execute a massive containment action plan against the novel coronavirus. State Health Secretary Bila Rajesh told reporters last evening that the area under 5-kilometer radius from the residences of COVID-19 positive patients will be targeted. They'll be notified as containment zones. The field-level health workers will visit every household in the zone from morning till evening today. They have been directed to screen all the public in the zone for symptoms like fever, cough or short breath. The COVID-19 positive cases in Tamil Nadu has gone up to 42, with 4 new cases reported yesterday. They include 2 with travel history abroad. More from a correspondent.
In Tamil Nadu, the number of beds in isolation wards in government hospitals is seeing considerable expansion. 2 major hospitals, one each in Chennai and Coimbatore, have been designated as exclusive COVID-19 treatment centers. In addition, the Rajiv Gandhi Government General Hospital in Chennai has made a facility with 200 beds to take in more patient load if necessary. The nearby Kilpauk Medical College and Hospital is also in the process of setting up an exclusive COVID-19 treatment facility. The government has identified more people who returned from abroad who disembarked in other cities than those within the state and later came by bus or train. Therefore, the number of people kept under quarantine in the state has gone up to over 43,500. Jai Singh, AR News, Chennai.
3 new confirmed cases of COVID-19 appeared in Andaman and Nicobar Islands. Following this, the total number of infected people has reached 9. The persons who tested positive are also a part of the same group which came from the Vistara and Indigo flights from Delhi on 24th March. The infected persons have already been admitted to GB Pant Hospital at Port Blair. For listing the contact details of the infected persons, teams have already been mobilized by Deputy Commissioner, South Andaman. At present, there are 280 rooms for suspected cases across the islands. One hotel with 42 rooms is especially designated as COVID-19 hospital in Port Blair.
In Jammu and Kashmir, 30 new positive cases of coronavirus have come up, taking the total to 33. These include 30 active cases, 2 recovered cases and 1 death. Following the spike in cases in last 3 days, around 6,000 people have been put under surveillance. More from our correspondent.
13 new cases were reported in Srinagar, Bandipur and Jammu. In the last 72 hours, J&K has reported 25 cases. Lieutenant Governor G.C. Murmu has ordered doubling up of the isolation and quarantine facilities and directed officers to trace the contacts of suspected cases so that random sampling and testing could be done as a precautionary measure. Home delivery of essentials in many areas has been started and mobile ambulances have been allocated for random health checkups of the students living in hostels. The J&K Resident Commission in New Delhi has established a helpline for stranded residents from J&K. Hundreds of students have been facilitated by the Commission to return to their home districts and dedicated hostels in New Delhi. In a novel initiative to encourage social distancing, the spokesperson of J&K government, Rohit Kansal, held a press conference with media persons using social media networking platform and shared the details with regard to government efforts in controlling coronavirus. Further, to ensure lockdown, J&K police has registered 337 FIRs and arrested 627 people for non-compliance of lockdown orders. Nasir Rathar, AIR News, Jammu.
And now for an overview of today's newspapers covering COVID-19 stories is over to Vaibhav Srivastav.
Thank you, Abhishek. The PM setting up a new fund, PM Cares Fund, to fight the coronavirus is one of the stories that finds prominent mention in the papers this morning. PM announces assistance fund for nation's war against coronavirus, says Mail today.
And now, before we end the special news program on COVID-19, the headlines once again. Prime Minister Narendra Modi to share his thoughts in Mann Ki Baat program of All India Radio at 11 a.m. today. People urged to donate generously in PM Cares Fund. Prime Minister says every contribution matters in fight against COVID-19. And government exempts farming and allied activities from lockdown. And with that, we end the special news program on COVID-19.